you're taking the time out to spend with us this afternoon. I'm Elizabeth Casper. I'm the Deputy Commissioner for Federal Programs here at the Georgia Department of Early Care and Learning, and I oversee the CAPS program. Presenting with me today are Bentley Ponder, the Deputy Commissioner for Quality Innovations and Partnerships, which includes the Quality Rated program, and Denise Jensen, the Director of Quality Rated. So today, we're going to share some updates about CAPS and Quality Rated that will support providers in becoming rated by the end of 2020 for CAPS providers, and there will be supports for other providers as well, or information that pertains to providers who are not CAPS participants as well. We have a lot of folks on today, so everyone is muted, but you are able to type into the chat box on the right side of your screen, and any questions that you have, please type them as you think about them, so that we do not neglect, so that we know what you want to know, and we're able to talk about it at the end. We will answer as many questions as we can at the end. Given how many people may be on the webinar, we may not get to every question, but if we don't get to your question, we will be putting out other communications that may answer it, or we may be able to email you and give you the answer to your specific question. One question that often comes up in our webinars is whether this will be recorded and available. The answer is yes. We are recording this webinar today, and we will be posting it on our DECAL website, hopefully by Monday. So with that, I'm going to continue to what we're here to talk about today. So today we're here to talk about our CAPS 2020 deadline, and as you know, all eligible child care providers serving families in the CAPS program will be quality rated by 12/31/2020. That is what I'm referring to when I say the CAPS and quality rated 2020 deadline. This initiative is aligned with DECAL's vision that every child in Georgia will have access to high-quality early care and education regardless of family income or location. And we are very excited to have some more detailed information to share with you today. So in that, I will be talking about some of our communication plans and what's going to happen over the next couple of months. And then Bentley and Denise will be talking about some of the supports that are in place, operational changes, policy changes, and then some milestones, and then some time for questions. And again, just want to remind you to please type in your questions in the chat box as you have them so you don't forget. Our communication strategy is pretty comprehensive. It would include informational letters and webinars. We're going to be having some stakeholder meetings in November, a public comment opportunity, some messaging in the CAPS billing portal and the quality rated portal, and then some targeted messaging and communication to families. And then you'll see stuff on our DECAL social media as well. So you may recall that we sent out a letter, the one that you probably signed up for the webinar based upon, introducing the 2020 plan and letting you know to come to this webinar to learn some information. And then, of course, today we're having that webinar. There will be another letter that will go out this afternoon or Monday that summarizes what we've talked about here in case you need the refresh, and for anyone who wasn't able to attend today. During November, there will be targeted stakeholder meetings, and then from November 14th through November 20th, there's actually going to be a public comment opportunity on DECAL's website. So everybody is able, regardless of where they are in the state and regardless of what they have time to do, if they're able to, are able to go on our website, and we'll be able to provide us some feedback on the things you're hearing about today, and perhaps some other information as well. And then in late November or early December, there will be a second webinar and letter with updates about stakeholder feedback and what our actual rollout plan is. Finally, in December, we will have regional community meetings that are led by our early education community partnership coordinators across our 6 regions. So you can look forward to those where we'll be sharing more information. The screen that you have up right now is going into the CAHPS billing portal. So for CAHPS providers, they will see this when they log into bill, I believe beginning on November 8th. And this will only show for child care providers who are not yet quality rated. If you are already quality rated, you're not going to see this because it doesn't pertain to you. So what this page is going to give us the opportunity to learn is who plans to become quality rated and who plans to opt out and is going to choose maybe to not continue to participate in CAHPS. And once you make those choices, if you choose that you will be quality rated, you'll also be able to let us know where in the process that you are. There also, as you can see, is an option. We know that some of the providers have a setup where the person who bills may not be the person who's able to answer this question. And so there is an option for somebody to say that they're not the appropriate person to answer. However, this will continue to come up for those folks until we do receive an answer. So it may be a good idea if you're in that situation to find out the answer so that you're able to enter it. And then we will be gathering this information from Maximus and contacting groups of folks based on the options that they choose and the stage in the process that they are at. With that, I'm going to turn it over to Bentley Ponder, who's going to talk a little bit about why this is so important.
Sure. Thank you, Elizabeth. And I really echo your comments, and so pleased that we have a good number of providers here. And I think that, and everyone wants to hear, all the work that we've been doing behind the scenes. And I think many of our providers are going to be excited to see what's coming up. So for those of you that aren't familiar or, it's been a while, the genesis of our 2020 goal was actually an early education subcommittee that was part of an education reform commission that in 2016 recommended our 2020 goal. And that is that all CAHPS providers must be star rated, which is either 1, 2, or 3 stars by December 31st, 2020 to continue receiving CAHPS funding. We've been working really hard behind the scenes on a lot of different things related to our 2020 goal. One of the things that we've been working on is there's been a training that's been developed by the QR team and the CAHPS team that's going to our family support coordinators within the CAHPS division about communicating with families around quality rated. And part of that has been, explaining why this goal was so important. And so I think you can see here in a very succinct way the 4 different points that we're talking about. That we want, to have more high quality programs available for our vulnerable children. We want families to have options to choose from more high quality programs. And I think, that last part is in terms of our CCDF dollars, we want to be responsible in ensuring that those are going to our higher quality programs, and quality rated, is our way of measuring quality. I would also add, too, that we've done a lot of research around quality rated. There is a great validation study that we published on our website earlier this year, and there you can see a lot of the research that we've done around quality rated. So those of you that know me know that I love data, so I'm going to spend a few minutes going to some data slides, and then I'm going to turn it over to Denise, who will talk about some of the new processes that we'll have in place. So where are we now? And this slide is fresh off the press, hot off the press. And it's very current data. So right now, of our 4,661 eligible programs, about 1,960 are star rated, and that's about 41%. Now, this is all programs, not just those programs with CAHPS scholarships or participating in the CAHPS program. If you look at that 41%, you'll see that 22% are 3 stars, 51% are 2 stars, and 28% are 1 stars. That's actually a really nice distribution if you look across the country at different tiered quality rating and improvement systems. And as I said before, it's one of the things that our validation study supports is the way that our different star levels are distributed. You'll also see there in the slide that about 33% of our providers, in addition to the 41%, are participating in quality rated. So that means many providers are well on their way to becoming rated. In terms of our QR goal, so here we're looking at it at the child level. So looking at our children with scholarships, and again, this data is also hot off the press, 66% children with CAP scholarships are now an equality rated provider. That is a tremendous increase in just really a short period of time. As you can see, this chart starts at March 2018 and goes all the way up through the end of September 2019. So that's a humongous jump. And then if you look there, 96% of children with scholarships are an equality rated program that's either rated or participating. So just going from that 66% to the 96% will get us very close to that 2020 goal. If we look at the same data from the provider level, you'll see that 54% of our providers who participate in CAPS are quality rated. That's a little bit lower than our child number, but that means that many of our programs that serve large numbers of children with CAP scholarships are those that are being rated, and then 89% of programs are participating. So again, just making that jump from the 54% to 89% gets us really close to our goal. Before I turn it over to Denise, who will talk about some specific processes, I am happy to announce that we are looking at a variety of supports for CAPS providers. We're working behind the scenes. We will be able to announce these very soon, but we want to make sure we have some time for some stakeholder engagement, and we're also figuring out exactly what the amounts, funding sources, and procedures look like. So just know that we are committed to providing some additional 2020 supports. We're working on that, and we'll have that information to you as soon as possible. And with that, I'm going to turn it over to Denise, who will talk about our new processes.
Good afternoon, everybody. I'm pleased to be sharing details about 3 changes that we are actually going to be making to our QR system that will ensure the childcare programs can move smoothly through the steps as they become quality rated. Some of these changes are going to be just temporary. We have 2 temporary policy changes that will impact programs that are currently star rated. I'm going to talk about those in just a moment. First, I would like to talk to you about a permanent operational change to our system that will allow providers to move smoothly through the quality rating process as they submit portfolios and select a time of year when they would like to have their ERS observation. This is going to be a permanent change, and we will be moving to this new system starting in December of this year. So what we're calling this system is a permanent operational change and cohort group slot system. And so in order to initiate this system, it takes a lot of work to create and actually change the process in which providers experience quality rated from the standpoint of submitting a portfolio, having an ERS observation, and then becoming rated. So in order to do that, we actually have to stop accepting portfolios, initial and reapplication portfolios, next Friday. And we have to do this so that we can ensure that the system will operate smoothly next year so that we can have enough capacity to assess and rate all of the programs that are expected to be new into quality rated. The new system will be operational on December the 1st. And at that time, providers that are submitting for an initial rating will register into one of 4 cohort groups. These cohort groups will be based roughly on the quarters next year, although there is the first quarter is a little bit different, and I will explain that when I share the next screen with you. Each of the cohort groups that we are setting up will have a set number of available program slots that will be available for all of our providers to sign up for, to guarantee that they will have the option to pick when they would like their observation to occur in 2020. Each cohort group will also have a set portfolio submission window, at which time you'll be required to submit that portfolio to ensure that your slot is reserved. A set observation window will also be accompanying each of the cohort groups, and this is the time that you can expect the ERS observation to occur in your program. There is also a set rating announcement window, and this will be the time that you will receive the email notification notifying you of your star rating, along with your ERS report and the scores from your portfolio. With this new system, the CAPS providers will have priority to register for their cohort group beginning December the 1st, 2019. The CAPS providers are required to complete the sign-up process by January 31st, and this ensures that we will have the capacity to make sure that all of those observations can be conducted before the 2020 deadline to ensure that your rating will be ready in time. Non-CAPS providers can sign up for a cohort group beginning January the 1st. So if you are not currently a CAPS provider, this is a great time for you to think about joining up and participating in the CAPS program. It will guarantee that you will have the ability to receive your slot starting in December, and you will not actually have to wait until January before you can sign up. So I'm sure you're wondering, how do I sign up for my preferred cohort group? And we've actually made that very easy for you, because you'll be signing up in your Quality Rated account. When you log into Quality Rated, you'll receive a new message that will prompt you to select the cohort group of your choice in 2020. The slide here that you see on the screen applies to CAPS providers who will see this message from December the 1st through January 31st, encouraging them to sign up for their selected slot. The message here will continue to show up until the slot has been selected. We are asking that all CAPS providers register for their slot by January 31st so that we can guarantee that we have the capacity to conduct those observations and rate your programs by the 2020 deadline. When you see this screen, you're going to want to either select the yes or the no to return to the home page. If you select yes, the next screen that shows up will be the selection grid, and I'll move there in just a moment. If you select no, then you'll have the ability to return into your portfolio, continue working and uploading and submitting the documents and evidence to receive your portfolio scores. However, this screen will continue to show until you select the yes button. Selecting the yes button will take you to the grid that will allow you to then select your cohort. So this next screen that you can see here is everything that will give you the information that you'll need to make the choice of which cohort group to sign up for. As I had mentioned earlier, there are 4 cohort groups in 2020. Each cohort group has an observation window based on the quarter that the observation will occur. So you're not actually signing up for the day or the month even of your observation. You are going to sign up and select which particular cohort group you would like to be a part of. So each cohort group, in addition to the observation window, will also tell you when to submit that portfolio. Currently, you can see on the screen here, we do not have the dates in there. That's because we're still having to work out exactly what the submission dates will be around each cohort group. And then you also do not see the number of slots available for each cohort group. We're also determining based on capacity of staffing to determine how many slots will be available in which cohort. But what you will see come December the 1st, when this goes live, a number of slots will be available for each cohort group, and then submission dates will also be there. And so as programs are selecting which cohort group they want to be a member of, the number of slots will continue to go down until there are no slots left in a particular cohort group. So we encourage providers to think very carefully about when is the best time of the year to have that observation in their program. Perhaps if your program is closed for a month or 2 during the summer, then you might not want to opt for cohort group number 3. If your program feels that you really need to spend a lot of time and some more time getting ready for that observation, then you might opt to check cohort number 4, which will be at the end of 2020. If, however, you feel that you're really ready to have us come out and observe those classrooms in the beginning part of next year, then you might select cohort group number 1, which runs from February through March. For those providers who do select cohort group number 1, we do understand that the turnaround time to submit your portfolio is going to be reduced. And so therefore, you can see in the notes section, you do have the option to request the rating process be reversed. And by that, what we mean is we will come out and conduct the ERS observation, and you will have until the end of that cohort window to actually submit your portfolio. If your portfolio is almost ready to go, then you might decide to still go ahead and opt for the observation window that is cohort 1, but you may be able to submit that portfolio within the submission window deadline. So again, all of this will be available to you in your quality rated account. Every time you log in after December 1st, you will see the option to come to this cohort group selection grid. Think carefully about which selection you would like. Selections cannot be changed because, as I had mentioned, once you choose your cohort group, that will decrease the number of slots available for other programs then to be in that group. So one of the things that we would strongly encourage is certain cohort groups may fill up more quickly than others. So if you know which group that you would really like to be a part of, we would encourage you to register early, register quickly as soon as it becomes available to you, and then you have secured your slot and guaranteed your observation and your rating for 2020. The next couple of things I'd like to talk about are what we are calling temporary policy updates. These are two changes that we are making to the quality rated program that are only going to impact programs that already have a star rating, and it will only impact programs for the 2020 year. So this is something that we will not continue past 2020, but this just allows us, again, to make sure that we can address the numbers of programs coming into quality rated next year to guarantee that everybody will be able to have a rating and have those observations in a timely manner. The first policy change that we are looking at is for those programs that are expiring in 2020. So when you log on to your quality rated account, if you see that your expiration date is 2020, you will automatically have an extension on your rating, and we will be giving you a hold harmless year. So what this means for you is that you will not have to do anything to your account. You will not have to log in and make any changes. You will not have to notify CAPS that you have been extended. All programs will automatically be extended to a new expiration date of 2020 with the same month and day as you would have had in, 2021 with the same month and day that you would have had in 2020. So we do know that there may be some providers out there, and you may be thinking that I really was looking forward to having my observation next year. I've had this same rating for the last 3 years. We've been working really hard to increase our rating. We would like to try and make that difference in our program for our children and our families, and we want that recognition. We completely understand that, and so we do have the option that if you would like to have your rating next year, you will have the ability to opt out of this re-rating extension. If you choose this option, you will be required to still submit your reassessment portfolio in the normal manner in 2020 and then continue through the rating process as you normally would. We have made a decision, though, because we do need to know how many programs are going to choose to continue through the process next year. And so we have set a deadline for notifying our quality-rated staff of your intent to opt out. So all programs that are in this category, if you are a program who will expire next year, Monday morning, you will be receiving an email. That email will be very detailed, and it will give you information specific to this re-rating extension. Within the email, there will be a link, and if you choose to opt out, you will need to click on this link to notify us of your intent to opt out. Then you will continue through the process as you normally would for a required reassessment. So let's take a look and see what that might look like for providers who are opting out for either option. So what you can see on your screen now is example 1, and this is provider A, who has an expiration date of June 15th, 2020, and they've decided that they would like to go through with their re-rating. So again, you would need to carefully read that email that you'll be receiving on Monday explaining the re-rating extension process. And then before November 30th, you would need to click on the link within the email to notify us that you intend to opt out of the re-rating extension. Then what happens is when you are within 120 days of your expiration date, your portfolio will become available to you. At that time, you'll begin working on uploading and submitting the documentation and evidence for your assessment for your portfolio scores. And you will be required to submit that portfolio prior to your expiration date. This is really important for you to know. If you do not submit that portfolio by the expiration date, then your rating will expire and your CAPS funding will end at that point. So it's very crucial. If you decide to opt out, please make sure you're working in those portfolios and you submit that portfolio in time. Otherwise, that rating will expire. So that's example one. So let's have a look at example number two, which is provider B, who also has a June 15th, 2020 expiration date, and they've decided to take the extension. So they are looking at having their rating extended to 2021. They're happy with the star rating that they currently have, and they've decided to accept this offer. And so for these providers, there is no action taken. You will again receive the email explaining your options to you, but you do not have to notify DECAL that you want to have your rating extended. That will automatically happen in December. When you log into your account in December, you will notice that your expiration date will no longer say 2020. It will now say 2021. And then we will see you in 2021 when you will come through for your required reassessment. So this is all of the information for those required reassessments, those programs that will be expiring next year. But we also know that there's another group of providers out there who are not expiring next year, but actually have an option to currently do what we call a request for reassessment. So you have an annual verification each year, which is the anniversary of your rating, and we require providers to let us know what they would like to do on their anniversary. They can either check in and let us know that they're happy with their rating and continue to do nothing for another year, or you can select to request some additional funds through our Continuous Quality Improvement Award as funds are available to maybe continue making changes to your program. Or you currently have the option to do a request for reassessment, which basically means you're going through the rating process again, submitting a portfolio and having another ERS observation. So we know next year that in efforts to ensure that we have the capacity to rate all of our programs, that we are going to have to suspend the option for voluntary re-rates. So that means that everybody who has this option will no longer be able to request a reassessment next year. So again, we know that programs may say to us, but hold on a minute, we've been working really hard since we got our rating in 2018 or 2019, and we really feel that we can earn that next higher star rating and potentially increase our tier. So for those programs, just like the expires, we have the option for you to opt out of this automatic suspension. And so if you choose to opt out, then you will be able to choose a request for reassessment in your portfolio just as you have previously, but you would have to do that before your annual verification date. Again, we have had to put a deadline around that because we do, again, need to know how many programs are going to opt out of this suspension, because that adds to the number of programs that we will need to be able to observe next year. And so we will, again, want to make sure that we have the capacity to be able to observe everybody and rate everybody that needs to or wants to have a rating in 2020. Again, that deadline date to opt out will be November the 30th, 2019, and this group of providers will also be receiving an email next week to notify them of all of their options around the request for reassessment. So let's take a look at what these examples will look like. So again, we're back to provider A, and this time the provider has an annual verification date of June 15th. And they've decided that they have been working hard and they really would like the option to go through the re-rating process and try again. And so after reading the email, they've decided that they would like to click on the link and notify quality rated staff that they intend to have that observation and continue with the request for reassessment. Again, these providers, when they're within 120 days of their anniversary date, will begin to work on the portfolio and make sure that that portfolio is submitted by the anniversary date. For providers who do not submit their portfolio by the anniversary date, they will actually be converted to an automatic check-in, and then they will not be able to continue working in their portfolio until the following year. So again, if you intend to take this route, you do need to submit that portfolio by your anniversary date, or your account will switch to automatic check-in. For example, number 2, provider B also has the anniversary date of June 15th, 2020, and they've decided after reading the email and thinking about their options that they are not going to take the request for reassessment. They are happy with their rating and they're going to continue as they currently are. So again, with this group, no action is needed. Providers do not need to notify us that they intend to not take the request for reassessment. This will automatically be suspended in their account. During the annual verification period, when you go and log in to see your quality rated account and check your options, the only options you will see will be the check-in or the continuous quality improvement award that will be available to you based on funding at that time. The option for the request for reassessment will be suspended, and that will not be a choice that you can make. So those are the 3 major changes that we're making to quality rated. Again, it's designed to ensure that we have capacity, that programs can plan strategically around when makes the most sense for them to come through the process. And it will also allow for our childcare resource referral technical assistance consultants to be able to be very strategic and prioritize in their planning as to the programs in their caseload that they're going to be working with. So I'm going to hand the screen back over to Elizabeth, who's going to be sharing with you some key milestones that are under consideration for our CAPS and quality rated dates.
Okay, thank you, Denise. Excuse me. There, as Denise just mentioned, there will be key milestones that are related to the deadline. The purpose of these is to continue supporting providers in becoming rated while also minimizing the potential impact on our families in the CAPS program. So the first milestone that we are going to talk about today is that providers who are not, we have to figure out a point in time for providers who are not yet quality rated and have not yet signed up for a slot to be observed, like Denise was talking about, that they would no longer be able to accept any new CAPS families. This would include new families coming into the CAPS program as well as families who are already in the CAPS program. Those families would not be able to select these programs if they wanted to change to a new provider. Let me make sure that I'm very clear that all we're talking about is for programs that have not signed up for a slot to be rated by the end of 2020. We're not saying that anybody has to be quality rated by this point. And the proposed date that we are considering for this change to occur would be May 1st of 2020. The second change or milestone that I want to talk about is that providers who have not yet been observed by the end of 2020, so 12/31/2020, for their star rating, would no longer be able to participate in CAPS. So after this point, we would start moving families to a quality rated provider as they come up for their renewal. Or if they elected to remain at a non-rated provider, the scholarships would be end-dated and CAPS would no longer pay for care. So as those of you who are already in the CAPS program are familiar, families come up once a year for their renewal, and that happens throughout the year. So what we're saying is at the time in 2021 that family came up for renewal, If you had not chosen to be observed by 12/31/2020, we would then ask that family to select a quality rated provider, and we would be end dating the certificates at your program if you have in that situation where you have opted not to become quality rated. So again, I want to be clear that it's just that you haven't been observed. You don't have to have your rating back at that point. And the date, of course, that we're proposing for that to begin would be January 1st, 2021. We want to honor that we have told you for several years now that the deadline is 12/31/2020. So any existing children would be permitted to remain in the program until that time. Finally, I just want to share with you some parent testimonials of parents who have children who are enrolled in quality rated programs. Quality rated positively impacts families and providers. These are quotes from families regarding their own experiences with a quality rated child care program. Given the changes that you've heard today, we realize it's a lot and that there is a great impact on child care providers with making these changes. With that, with what we've proposed, we believe, and I know you haven't heard a lot about them yet, but we are hoping to really get a lot of information from stakeholder engagement about supports that we're going to be able to provide. And we believe that we're enabling providers to be successful in becoming quality rated. But I want to just draw back that our primary focus with this 2020 deadline is making sure that every child has access to quality child care. And so, and it aligns, again, like I spoke about in the very beginning of the webinar, with our vision that all children will have access to high quality early learning environments despite their income or location. And so with that, that concludes our presentation of our content. However, we'll be glad to answer some of your questions. And please, if you haven't already, please go ahead and type in any questions in the chat box to your right, and we'll answer as many as we are able to.
Sure, and Elizabeth, we're getting a lot of questions from all over the state, so let's let's jump on in. So this one comes from one of our friends in Metro Atlanta, and they were asking specifically about how this is going to impact the tiered reimbursement rates. And we didn't really talk about what a benefit in terms of tiered reimbursement being quality rated is. Can you talk a little bit about the tiered reimbursement rates and how this will impact that?
Yeah, so for anybody who doesn't know, every quality rated program gets a bonus on top of the regular CAPS rates that we pay for caring for children in the CAPS program. So a 1-star program gets a 10% bonus, a 2-star program gets a 20% bonus, and a 3-star program gets a 40% bonus above the CAPS rate. So if you weren't already aware of that, it's a really big motivator, I would hope. There's lots of money on the table to take if you haven't gotten quality rated as a reason to do it.
That's great. So Denise, we're getting a lot of questions about the slots, and some of the questions are really specific to certain providers. I think we'll be able to answer those via the webinar, but if a program has a question about their specific case, should they call the quality rated help desk?
So starting on Monday, before calling the quality rated help desk, if you log into the quality rated account and along the bottom of the quality rated page, we have lots of resources down there. And one of the resources, you're going to see a new tab, which will be 2020 goal. And within that tab, there are going to be some frequently asked questions that are related to all of the things that we've spoken to today. So I would say first, go and see if your question has been answered in our frequently asked questions. And then at that point, if you do have another additional questions that may be specific to your program, then yes, of course, please do reach out to our help desk with that question, and we will be able to have somebody respond to you.
Okay, that's great. Some of the more general questions we're getting. So if a program is a required reassessment and they're going to opt out of the extension, do they still use the cohort slot system?
No. So if you are a program who is expiring, and when you receive your email on Monday, you decide to go ahead and click on that link to let us know that you're opting out, your process will continue just as it does currently, which basically means that when you're within 120 days of your expiration date next year, you will start to get emails notifying you to go ahead and to work on your portfolio and to submit your portfolio prior to your expiration date. You will not be part of the cohort group. The cohort groups for this year only, for 2020 only, are just for those providers who do not yet have a star rating. So if you have an initial portfolio or you have a reapplication portfolio, then you will be in the cohort system.
Okay, and this is a specific question, but it gets a little bit about what you're talking about, so I'm going to go ahead and add this. So we have a program, and they're actually now within that 120 days, and they're working on their portfolio, and it looks like this program is going to want to submit. They're going to take the opt-out option. Will they still be able to work on their portfolio? Is their portfolio still available now?
Yes. So if you're currently working within your 120-day window and you would like to opt out, then yes, your portfolio will remain available to you and you will just continue on with the process. But you do need to make sure that you email us that you are opting out, because if you don't, then that expiration date will change and then your portfolio will not be available to you. So that will be crucial that you respond to the email.
Okay, that's great. And then just one more question for you, and then I'll turn it back to Elizabeth. What if the program's up for quality rated renewal in December 2019? What would you suggest they do?
Unfortunately, the extension is only available to programs that have an expiration date in 2020. So if you still are between today and the end of the year and you have a 2019 expiration date, you actually are going to be required to still submit your portfolio that you are currently working in, so that we can come out and get your observation completed in December or January to get you your re-rating.
Okay, that's great. Elizabeth, I'm going to turn to you. I've got a couple of questions here. So one of our providers wants to know if they'll be assigned a person from our CAPS office to communicate directly with.
So I think that many of you have had some interactions with our family support section of our CAPS division, and we are assigning the renewals for children in the CAPS program by provider. And the goal with that is that we have, hopefully, depending on how large your center is, sometimes there could be more than one person that you're dealing with, but generally one CAPS person you're dealing with on renewals. For new families, we have a different section, Scholarship Administration, that actually processes our new applications. So what I would encourage you to do is, if you feel like you're trying to call and you're not having luck getting through, then go to our Contact Us section of our website. When you select options of that you are a child care provider and what you're trying to do, it actually directs that inquiry or that question to the right group of people. So it's not just going to one big storehouse of questions, which you may be concerned about. So if you haven't used Contact Us on the CAPS website, that's again at www.caps.decal.ga.gov, then please, I would encourage you to use it if you're not having as much luck you feel getting through on the phone. But we are trying to make sure that you have somebody available to you and that there will be some relationship building with that family support person.
Okay, and this is a question, it's a little bit of a foreshadowing from the webinar we'll be doing in late November, but they want to know what happens to a new program that opens in 2020 and would like to accept CAPS scholarships.
That is a fantastic question.
It is a great one.
It is, and that's something that we are thinking a lot about too, because we have to have a way to have new programs, right? So we are going to be doing some stakeholder engagement this month. That is one of the specific issues that we're going to be looking at, and how can we do that. We're also looking at how other states who have already done something similar to what we're doing here, how they have handled new programs. as well as similar issues within a program losing a star rating, things like that. And I think that we'll have much more information about that at that next subsequent webinar that will be at the end of November or beginning of December.
Oh, that's great. Denise, I've got a couple questions here, so I'm just going to try to summarize them and make them as general as possible. But we're getting questions about how the portfolio submission relates to the quarter, to selecting the cohort. So can you talk a little bit more about that?
Would it help if I went back on the slides maybe, so we can go back so that we can see what the grid looks like? I can just bear with me a moment as we get back to that slide. Okay, so as I mentioned while I was explaining how the system works, there are 4 cohorts next year, and each cohort group consists of the number of slots available in that cohort group, the portfolio submission window that is required for that cohort group, the observation window that occurs with that cohort group, and then the rating notice window that occurs to that cohort group. So as you can see, if you can see the screen now, each of those portfolio submission windows do not yet have dates in there, and that's just because we have not figured out what the final dates need to be. But they are all linked together. So basically, when you go in and select your cohort group, you're going to simply check the box that says select 1. You'll either select cohort group 1, 2, 3, or 4. And then depending on which one you select, all of those trigger points will occur for you. So if you select cohort group number 2, there will be dates in that box that will tell you when you have to submit your portfolio for that cohort group. The dates in the observation window will be the 3-month period in which the observation will occur. You will, once the assessor team has been notified that you're in this cohort group, the assessor team will actually go ahead and schedule the observation for your program, and then you will actually be notified of the 30-day window in which your observation will actually occur within that cohort group. You'll receive that information via email, and it will also actually be showing up on your quality rated home page. So once you've selected your cohort group, you don't have to remember, oh my goodness, which cohort group am I part of? When do I have to submit my portfolio? That information will all be populated. So every time you go into your portfolio, the first thing you will see will be a reminder of when you need to submit that portfolio and when that observation will be occurring.
Okay. And Denise, we also have a provider here, and they're ready now to submit their portfolio, and they want to know if they sign up for a cohort. And I guess the answer is if they submit their portfolio by November 8th, then they don't need to sign up for a cohort.
Yeah.
If they submit it after December, after that.
If you're going to, remember I had mentioned at the beginning, in order for us to switch over to the new system, to give us time to transition and to build the screens out into everybody's account, there is some downtime where you cannot submit a portfolio. So if your portfolio is ready to go now and you are ready to submit and you want that observation to occur in December or January, then you can submit that portfolio now, but you have to submit it before the 8th. Because after the 8th, you will no longer be able to submit, and then starting December 1, that you will have the ability to select your cohort group.
Okay, that's great. I will point out here, we do have one question here about the technical assistant aspect of quality rated. I will pass that question on to Susan Adams and Christy Moore, and we'll be able to get you a response to that following the webinar. We're also getting a lot of questions here about bonus packages, and that's our current bonus package structure and also the one that we'll be able to implement in 2020. And I'll just say here that we are still figuring out and finalizing what those details are. We will have information, I promise, within the next couple of weeks, and we'll be able to answer all of those questions. So we're not ignoring those questions, we're just waiting until we have all of our I's dotted and T's crossed and we get additional feedback, and then we'll be able to make those announcements. Denise, just kind of a general question. Someone just asked, how many slots are there per cohort?
So that's the thing that we are in the process of working on now. So we the way that we are able to determine the number of slots is looking at the number of assessor teams that we have. So those are the ERS observers who come out to your programs and conduct those environment rating scale observations. So we know how many assessors we have. We know how many observations can potentially be conducted each week. And the number that we need to get to determine how many slots is really looking at the number of potential programs that we feel will need to be rated in 2020. So that's all of our CAPS providers who are not yet rated that intend to come through the system. That's those programs who are expiring next year and have decided to opt out of the extension. They will need to be rated and observed and rated. That's our request for reassessment folks who decide to opt out of the system and will need to be observed. So once we have a good count on the number of programs potentially to observe next year, then we'll be able to determine, based on the number of assessors we have, how many slots will be available each cohort group. And then when the system goes live on December the 1st, you'll actually see the number of slots available within each one of those cohort groups for you to be able to select from. And that's really why we're encouraging providers to sign up quickly if they have seen this information here. So today you're seeing what those observation windows are. If you see these dates here and you know that you really want to have your observation between July and September of next year, then I would say as soon as the slots go live, sign up for that slot, and then that guarantees you that you have your first choice for the group that you would like to be a part of.
And then these kind of related to that, sorry, the questions are coming in, so I'm reading them as they're being passed to me. But someone asked that I guess they're ready for their portfolio, but they may want to wait to sign up for cohort 1. Is there any negative impact to that program?
No, there's no negative impact at all. If your portfolio is ready to go and you really like the idea of being in a slot and being observed in February or March, potentially having some incentives or bonuses available, then absolutely sign up, wait, and then sign up for your slot December 1, get the cohort group of your choice, and we will be seeing you in February or March.
Okay. And then just last question, then I'll turn it back to Elizabetta. We did have someone that asked and said, like, let's say they sign up for a fourth quarter cohort, and for whatever reason they don't get an observation or they're not rated by the end of 2020. Are they still eligible for CAPS funds in 2021?
Okay, so a couple of things there. You will definitely, if you sign up for fourth quarter, you will definitely have your observation before the end of the year. That's why we're moving to this system, that it does allow us to guarantee that we have the capacity to observe everybody before the end of the year. However, it's a really good question because providers that may have their observation in December probably are not going to have their announced rating given to them before February, because it does take some time after the observation for a pretty extensive review process of all of the ERS scores and the portfolio scores. So for those providers who have not yet actually received their announcement of their rating before the end of next year, nothing will actually change for you in terms of your current CAPS standing. So you will still continue to receive your CAPS funding as you currently are, and then once you actually have that rating announced, then that will be determined at that time based on your star rating as to your tier reimbursement increase.
Okay, and this question here, I think either one of you could answer. And basically, the question is about being non-compliant, and is there going to be a QR probationary period?
And I would answer that the same way as I did the new programs. That is definitely one of the topics that we are going to get feedback on this next month. And in that next webinar, we will have more specific information that we can share. But again, we are talking to other states and learning about what they do, and are definitely interested in all of y'all's feedback about that as well.
And good, thank you. And Elizabetta, I feel like this question goes back to our tiered reimbursement question a few minutes ago. So how does a provider sign up for tiered reimbursement? How do they get those bonuses?
So once a provider who accepts CAPS receives their star rating, within the Maximus billing portal, there's an opportunity for them to fill out what we refer to as an application or an acknowledgement And once you fill that out, you don't have to tell us what rating you are. We get that information from the quality rated system. However, you do have to acknowledge there's several legal aspects of it that you have to acknowledge that you're receiving this and why and whatnot. And then you would start receiving that bonus on your CAPS payment.
Okay. Just to kind of give you both a break, we got a data question a few minutes ago, and so I was able to text our Friendly Neighborhood Research team, and they got me the answers pretty quick. So of those 4,661 eligible programs mentioned, how many of those programs support children receiving CAPS? So the answer to that is actually 59% of the 4,661. If we take a subset of that of only licensed programs, it goes to 71%. So just an interesting data point there. We've also, and this is kind of switching gears a little bit, but I think it's a fun question, and Pam Stevens will certainly be glad that it was asked. But we had a provider that asked where school age fits into all of this.
So currently, school-age programs that are standalone school-age programs are eligible to be quality rated, and we have many standalone school-age programs that do in fact have a star rating, and so these programs would fall under the CAPS 2020 deadline, just as other childcare programs that are star rated and are CAPS providers. So if you are a standalone school age program, and by that we mean you do not have any other ages, you don't care for infants, toddlers and preschoolers, you just care for school age children, and you are a licensed facility, then you are eligible to be quality rated.
Okay, that's great. And Denise, if you're a provider and you're not yet familiar with everything with quality rated, or I know that there's some myths out there or some misconceptions that quality rated, doesn't support academics or doesn't support children's growth and development, where's the best place for providers to go to get more information?
So I would encourage you to go, well, there's a couple of places that you could go. You can go to qualityrated.org or qualityrated.decal.ga.gov and be able to find lots of information. At the bottom of our screen, there's all kinds of resources to look at, to give you information about that. But the other really great resource that we have is our childcare resource and referral agencies around the state. You can find access to them, again, from the Quality Rated website, but they are there to help answer all of your questions. They're there, they provide orientations to Quality Rated, so you could sign up for an orientation and be able to hear about the process and the steps that are required for the system, and then sign up with a TA provider who will be able to come and provide assistance to you as you work through your Quality Rated account.
Okay, great, thank you. Elizabeth, I just kind of asked you to put your licensing hat on back from the day, Throwback Friday. So for centers that are open and choose not to participate in Quality Rated, does this have any impact on their license?
No, absolutely not. If a center chooses not to become quality rated, who is serving CAPS children right now, they would, of course, be allowed to continue to serve their private pay children. We just, after December 31st, 2020, would not be able to allow them to participate in the CAPS program any longer.
Okay. Oh, okay. All right. So I'm going to make this our last question. I know we're getting to the end of our time, and I love this question, so I think it's a great one for us to end on, and I think any of us could answer this. But they are quality rated, and this provider wants to be able to recruit new families to the CAPS program. How would you suggest? That
is a wonderful idea, and I agree with you, a great way to end. It is easy to find lots of community resources where you can get referrals for families. If you look in your own community at some of the agencies that serve families, some other programs that serve families, and let them know that you are available and that you have a desire to serve especially vulnerable families, you can definitely get families who are enrolled in CAPS. Additionally, if you go to, if a family goes to All Georgia Kids and calls them for assistance in getting quality childcare, they will be glad to make referrals and definitely are helping families find affordable care, but also helping them to understand the reasons why it's important to select quality childcare.
Great. Well, I did tell a little bit of a lie, so I will answer one last question before we end. So someone asked with our frequently asked questions document that's going to be posted, I think on Monday on our website, will that take into consideration some of the questions posed today? And my answer is yes, it will. But I would also say, too, those documents will be living documents. And as we get more and more questions throughout the process, we will continue to update them. So I would say keep checking back. And with that, I think we're at 1:30, and we want to be respectful of everybody's time. So, Elizabeth, I'll leave you with the last word.
Okay. Well, thank you. I just want to reiterate how much we appreciate you taking time out of your busy Friday to spend an hour with us. And to remind you that this webinar will be posted, and there will be a follow-up letter either later today or on Monday that will give you a summary of what we talked about today in writing, and that stay tuned because we'll be calling upon you again if you'd like to join us again to hear more information and more details. And I guess the teaser would be that we would hopefully be able to talk more in depth about those bonuses and incentives, as well as tell you how that stakeholder engagement in the month of November went. Mm-hmm. And what we learned from it, from your peers, or some of you, perhaps. So thank you again.
And the public comments.
Yep, and the public comments. So thank you, and I hope you have a wonderful Friday and a great weekend.
Thanks.